Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes, and today we are doing another topic. And these days we are covering the topics which are made by Cambridge Boxer. They are actually the authentic OET examination takers, and especially the creators of the right material. It's the responsibility of the Cambridge that has been given as an organization. They are basically OET themselves. So you're taking their question papers one by one. So again, speaking role play, you will get 3 minutes to prepare, and you will have 5 minutes to speak. And you can write only anything on the role play, and there are no marks which are deducted for facial gestures. Facial gestures has no marks. That means only audio recording will be there, and you just need to speak well. So first of all, you will read the role play. Community health center. So आप एक community health center के nurse हो. You see an 18-year-old patient who is in his last year of high school. She is worried about an approaching examination and is having panic attacks. So last year having panic attacks. She is seeing you advice on how to manage them. तो वो आपसे मिलने ही इसलिए आई है so that you can tell. Find out the details about the panic attacks, like what are the symptoms, duration, previous occurrences. So whenever I tell you, these are the same things which are given to the patient as well. So you are 18-year-old and in last year of high school. So this is patient task. तो यही आपको समझना है कि there are two kind of task. एक आपका टास्क होता है whether you are doctor or you are a nurse. एक ऐसे ही पेशेंट का टास्क होता है. तो पेशेंट भी अपने टास्क को अच्छे से करेगा. जैसे आप अपने टास्क को अच्छे से करते हो तो पेशेंट भी अपने टास्क को अच्छे से करता है. तो आपको फर्स्ट टास्क पूछा हुआ है कि पेशेंट से ड्यूरेशन पूछना है, अकरेंस पूछनी है, तो उसको सब कुछ, तो पेशेंट को भी सब कुछ दिया हुआ. सो एवरीथिंग हैज बीन गिवन टू पेशेंट एज वेल. You are 18-year-old and your last year of high school, you are very anxious about so the same situation has been given, what has been given to the doctor or nurse. You are experiencing panic attacks, sharp pain in your chest. You are seeing nurse to get advice on managing them. तो अगर GP का होगा तो यहाँ पे सिर्फ GP लिखा हुआ आ जाएगा. Everything would be same. अगर डॉक्टर्स का केस होगा तो यहाँ पे लिख देंगे that you are seeing the GP or the doctor to get advice on managing them. When asked, say you are experiencing episodes of shortness of breath, यानी patient आपको ये बताएगा that he was having episode of shortness of breath. Trembling, loud heart pounding, जैसे anxiety में होता है. These are the symptoms which happen in anxiety, as you know. Shortness of breath, trembling, chest constriction, sharp pain. Sometimes these last for 20 minutes. You do not have any other symptoms. You have not experienced anything like this before. तो patient को ये task दिया हुआ है. When asked, say you have an important exam coming up in 2 months time and you feel anxious about it. तो आप वो आपसे पूछेगा कि are you anxious about something? Say you are really worried. You think that the panic attacks might indicate a more serious problem. तो being patient जो आपका examiner है वो आपको बोलेगा कि मुझे ऐसा लग रहा है कि ये panic attacks जो हैं ये simple panic attacks नहीं है, आपको गलत फहमी हुई है, मेरे को serious problem लग रही है, मेरे को तो ये हार्ट कंडीशन लग रही है, that I am having a heart condition, that's why my chest constricts and I have a sharp pain. You will try some of those strategies जो आपको strategies देंगे. Ask if there is anything else that you can do. तो being patient आपसे ये पूछेगा can I do something else? Say weekly visits to health center should sound like a good idea. तो ये तो पेशेंट का टास्क है. ये टास्क आपको नहीं मिलेगा. मैंने आपको ये टास्क इसलिए दिखाया, आई हैव मेड यू सीन दिस टास्क बिकॉज आई वांट यू टू नो कि पेशेंट को भी एक टास्क मिलता है. लेकिन बीइंग डॉक्टर्स और नर्सेज आपको सिर्फ ये मिलेगा. तो आपको यहाँ से चलना है, आपको अपने टास्क को फॉलो करना है. सो आप एक 18-year-old पेशेंट को मिल रहे हो जिसको पैनिक अटैक्स होते हैं और वो आपको मिल रहा है ताकि यू कैन टेल हाउ टू मैनेज देम. सो फर्स्ट ऑफ ऑल you will ask the details whether you are a GP or you are a nurse. आप कहोगे good morning, my name is Bhupesh, I am a doctor or I am a nurse over here. So I have got to know that you are having some problems. So could you please explain me your problem? Well, doctor or nurse, I am not sure what is going through, but yes, I have been told that it's like panic attacks. Okay, so I would like to find the details about the panic attacks. So could you please tell me your symptoms? Then patient will explain the symptoms. Then you will say, could you please tell me about the duration of the symptoms? So he will say it's around 20 minutes because that has been given to him. Okay, then you will say, are there any previous occurrences? He will say no. Explore possible triggers. So do you think there can be any triggers of this panic attacks? Then you explain that patient symptoms are a normal response to feeling anxious, nervous or fearful. Whenever you are anxious, whenever you are nervous, whenever you are fearful, these are the normal response of the body where symptoms are the same like heart pounding. All these things happen when we are anxious. Reassure the patient about panic attacks, that these are the panic attacks common before exams, can be managed. Make recommendations about self-care, that you should go to the quiet space, visualize something peaceful, practice healthy habits, resting, eating well, getting enough sleep. So these are the advices. Advise the patient to return to the community center weekly, exercises for relaxation and breathing. So this is the task that has been given. You can be a doctor, you can be a nurse. So I'm just gonna speak in the flow, like how it will happen in the exam. Good morning, my name is Bhupesh. I am your doctor for the day. So I have got to know that you have been facing some panic attacks. So am I right? Well, yes, doctor, but I really am not sure whether these are panic attacks or not. Okay, so don't worry, we are here to resolve your problem. But before resolving your problem, I would like to know about the symptoms. What kind of symptoms are you having? Then patient will say, see doctor, I am having many symptoms, especially like I have got some shortness of breath, trembling, sometimes, my heart pound, it beats like anything. And chest constriction is also there. There is also some sharp pain. So I feel like maybe I'm suffering from some heart condition. See, first of all, I would like to tell you, you are not having any kind of heart condition, because you are 18-year-old and on the top of it, your weight is well managed. It's just about the thing that it can be panic attacks. And the symptoms you have told are pretty common symptoms when it comes to panic attacks. So yeah, and could you please tell me about the duration? Well, duration is about 20 minutes and then they are gone. Okay, so you are saying that it happens for 20 minutes. Am I right? All right. Okay. And are there any previous occurrences? Well, no, doctor. Okay. So could you please tell me, are there any kind of triggers? Like, have you noticed anything which causes these panic attacks? Well, no, doctor, I don't know. It's happening for the first time. Okay. So let me explore few more options. So are you having any kind of a tough deal, in the coming 1 or 2 months? Yes, doctor, I'm having an exam which is coming after 2 months and I'm anxious about it. Okay. So I would like to tell you, see, these are the kind of the common responses that body gives when you are feeling anxious, nervous, or fearful. As you have just told me that you are having a final exam after 2 months. So obviously these are the things which are making you having panic attacks. So are you sleeping well? Oh, not really, because I have been working a lot harder, because it's my last year. I want to do my best. It's gonna set up my grades. Okay. So are there anything else, like are you eating good food? Are you skipping your meals? Well, yes, doctor, I'm skipping my meals. There is no particular schedule. Okay. So I've got to know about your problem. As I have already told you that you are having panic attacks and there is nothing else. It's not about any heart condition, and these are common before the exams, but you will be glad to know that it can be safely managed. First of all, I would like to give you some recommendations about the self-care. It is very important when you feel anxious, fearful, or nervous, go to a quiet space. It is very important to calm yourself down. So take deep breaths, it will definitely help you. Also visualize something peaceful. So if there is anything that you like and brings you at peace, or even if you want to chant any name, you can do anything. So you can chant God's name or whatever you like, just, or you can listen to the music to bring yourself at peace. Also, there are some other practice habits that I would like to tell you, that there are some healthy habits which you can practice. First of all, rest is the most important thing. As you have just told me that you have not been sleeping well, it is not a very nice thing. I do understand you have pressure and you want to perform in your studies, but if you will not rest well, it will rather impede your performance. So please understand, resting is very important. At the same time, eating good food is very important, because food gives you energy, and at the same time when your stomach is full or filled, you feel good, so good hormones are released in the body. So please understand, it is very important. There are some hormones which are very important and which are released when you rest, when you eat well, and you get enough sleep. Apart from this, there are some good exercises which are very important to be done. For this, I recommend you to go to a community health center on the weekly basis, or come to community health center on the weekly basis to have the exercises which are primarily relaxation and deep breathing exercises. So over here we will teach you about these exercises, and these exercises will help you to recover quickly and to prevent these panic attacks to happen. So are you understanding? Yes. All right, then take care of yourself. And again, I have said you reassurance is very important. And I would like to reassure you, you have nothing apart from the panic attack. So if you will follow the precautions and the habits which I have told you, and will change your lifestyle for the moment, the condition will definitely improve. All right. Okay. Anything else? Well, no, that's it. Here is a leaflet. It contains all the information which I have already told you. Please read this leaflet. And if you have any doubt, you can always call us anytime. All good. Okay. Then take care. So this is how you execute the role play. This I said wrong because I was doing the role play for a doctor. So in that case, you will say you can go to community health center. That would be given in a different way. But if you are a nurse, again, the role play remains the same. You know, it's just, there is no difference. It's just about doing it in a different way because one is as a nurse and other one as a doctor. So in the nurse cases, again, it says, good morning. My name is Bhupesh. I am a nurse. How are you feeling? Well, I'm not feeling good. I'm having panic attacks as I have been told, but I feel it is a heart attack. Okay, first of all, let me tell you that we have already observed you, and these are just kind of the panic attacks. And also have come to know that you are having your final examination approaching. So may I know when is your examination? Doctor, nurse, it is after 2 months. Okay, please don't worry. Let me ask you a few more questions. Would that be all right? May I ask you some questions? Yes, nurse, of course. So tell me your symptoms, tell me the duration. Are there any prevalence occurrences? Okay. So as you have told me that you are having exam after this, so these panic attacks are kind of the normal responses. Whenever a human feels anxious, nervous, or fearful, these attacks are common. So you don't have to worry. And I reassure you that these are just panic attacks. These are not kind of any heart condition. It is common before the exams and it can be easily managed. And after the exams, it would be completely gone as your worries will be gone as well. So please understand this is just a very temporary phase. And if you will understand the right precautions, right preventions, you would be all good. So I would also like to tell you some recommendations for the self-care. Whenever you have any kind of panic attacks, please go to the quiet space where calmness is there and also try to visualize something peaceful. You can sit in front of God or you can sit in the quietest of the places and can meditate for some time. Also, you can do some deep breathing exercises. Taking water sip by sip is also a very good idea. Apart from that, we would like to encourage you for healthy habits that you should do your take complete rest, eat healthy food, and get enough sleep. All these things will help you to increase your patience and also you will feel better. Is it all right? Okay. And in the last, I would like you to return to the community health center on weekly basis so that we can monitor your progress. And also there are weekly programs for the exercises such as relaxation and deep breathing exercises, which will further help you to compensate with your stress. Is it all right? Okay. Then take care. And I reassure you, there is nothing to worry. It's just a very temporary phase and would be gone within a week or two if you follow the precautions. Apart from this, I'm giving you a leaflet. It contains all the information about the stress management and various techniques like yoga and meditation that will help you to prevent these attacks. All right. Take care. We'll catch you after a week. That is how you execute your role play. So I wanted to tell you, I made it little cumbersome, but today I wanted to tell you even patient will have specific things to be said. He would also be having a role play. So don't worry, but yes, patient can be anxious, patient can be active, he can be aggressive depending upon the task, but sometimes depending upon the personal nature as well. So you all are supposed to do your best. And again, you should have a habit to speak for 5 minutes at a stretch. This is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.